The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar titled The Promise of Heart Rate Variability and Respiratory Training, Advances in Knowledge, Technique, and Applications. Today is going to be an overview of heart rate variability and respiratory training as it exists with in-clinic exercises, along with new additions to the availability of mobile devices and apps for training outside of the office. For those of you who are not so familiar with him, today's presenter is the ever-popular Dr. Donald Moss. There's a very brief synopsis of his credentials because the list is quite long. I'd like to let you know that he is professor and dean of the College of Integrative Medicine and Health Sciences at Saybrook University. There, he has initiated graduate programs in nutrition, applied psychophysiology, integrative wellness coaching, mind-body medicine, and most recently, integrative social work. He is a clinical health psychologist with an MA and PhD, is licensed as a psychologist in Michigan and is nationally certified in biofeedback and hypnosis. He has been the head of many organizations and professional bodies over his long career, providing trainings all across the globe, as well as authoring and co-writing many books and publications. Dr. Moss's two most recent books would be, firstly, a co-authorship with Dr. Frederick Schaefer for A Primer of Biofeedback, and a separate co-authorship with Angeli, I'm mispronouncing that, my apologies, Angeli McGrady for Integrative Pathways, Navigating Chronic Illness with a Mind-Body-Spirit Approach. Before I allow Dr. Moss to take over, I just want to introduce myself and how the format of this webinar is going to be going. Hello, my name is John Bale. You might recognize me. Hopefully you do. If not, that's okay. In today's webinar, we are very much encouraging you all to ask questions. If ever you have any questions, you can submit those using the questions tab found in the GoToWebinar control panel. Where is this control panel found? It depends on your computer, but usually it's at the upper right. And you can click on that little Go Questions tab in order to write something in. Just take a moment now to make sure that, in fact, you all can hear us and you all can locate the questions box. Please let me know what your summer vacation is going to be, because I'm excited to know, because I suspect I am not going to be getting any. So I need to live vicariously through all of you. As you take a moment to just let me know that you can hear us and that you are in fact alive and able to use your keyboard and find the questions box. I want to let you know that this event is being recorded. So if you by chance have to leave early, you'll be able to get a copy of that recording later on. And obviously those who are not attending live will be able to get this recording or hearing about it right now. You live attendees can also download two of the handouts we are providing going to the handouts tab. If you want to do that, all you have to do is click on handouts and download those. One is the references for today's presentation, and the other is a copy of Dr. Moss's webinar. Okay, so has anyone managed to send in any questions? And the answer is absolutely not, so that makes me a little bit worried, but I'm sure someone out there is able to hear us and see this. So let me type a question myself. Oh wait, there you go. Hello, John. Okay, well, thank you, at least one person, for being the delightful guinea pig we all needed to let me know that they can hear us. And other people are also saying they can hear us and they're tuning in. Excellent. Thank you. It was a little bit late, but you had me worried. But I know that, in fact, we can be heard and you can interact with us. Excellent. All right. So with that being said, I would like to have Dr. Moss take over and we can enjoy this wonderful presentation. Thank you very much. Go right ahead.
Thank you, John, for that delightful and diverting introduction. It's always my pleasure to interact with you and with Thought Technology. I'm going to invite our attendees now to take a moment for a moment of mindfulness, a moment of meditation. Begin by finding a comfortable position in your chair. Allow yourself to let go of any tensions of the day, allowing yourself a moment of restoration and renewal before we begin the formal webinar. And in this moment, allow your body to relax. Allow your mind to quiet. And allow your heart to open. If it's comfortable, allow your eyes to close as well. And finally, guide your breathing to become gentle, slow, and even. Breathing gently, breathing slowly, breathing in a relaxed fashion. Once again, allowing yourself a moment of renewal, a moment of restoration. Opening your mind, opening your heart. And now stretch, and I will begin. Somehow I seem to have lost my overview slide, which was supposed to tell you where we're going. I'm going to briefly talk about the basics of heart rate variability. Then I'm going to introduce some of the physiological mechanisms that we've identified for heart rate variability, present an overview of some of the available portable consumer-oriented products available to teach heart rate variability, and then present some recent studies, especially those utilizing home-based, consumer-based devices. Then briefly, as time allows, I will talk about the psychophysiology of respiration as well, review some of the basics of respiratory biofeedback, and then as time allows, one or two case research reports on research with respiratory interventions. So what do we mean by heart rate variability? Well, heart rate variability is the moment-to-moment change in the time intervals between adjacent heartbeats. A healthy heart, as Fred Schaefer says, is not a metronome. It's not that little tick, tick, steady, steady ticking on a metronome if you're a piano student at any time in your life. Healthy biological systems show large oscillations in their activity. When our heart loses its variability, the risk for illness and for death increases. Unfortunately, statistics show very clearly that we do lose variability in our heart rate with aging. And in the 8th and 9th decades of life, the amount of variability we've lost correlates quite strongly with our risk of death. So what causes heart rate to vary? Heart rate variability is an index of neurocardiac function. So it's heart-brain interactions, and especially dynamic autonomic nervous system processes. Current research is emphasizing the parasympathetic system, the vagal nerve, and the parasympathetic inputs, which cause moment-to-moment oscillations in heart rate and increase our health and performance. When we have high parasympathetic input, when we have large oscillations in heart rate on baseline, we show better health, better resilience, and higher human functioning. So heart rate variability is a property caused by multiple interdependent regulatory systems in our physiology. They operate on different time scales, which help us adapt to our environment and to psychological challenges. The neurophysiology of heart rate variability shows that we have the entire nervous system involved in heart rate variability, from the prefrontal and insular cortex to the intrinsic cardiac nervous system, that nervous system organized around the heart itself, the medulla oblongata. All of these function as integration centers, with the final output being heart rate variability. Respiration is very important. It's a strong contributor to heart rate oscillations, and I'll say some more about that. The balance between sympathetic and parasympathetic activity in our autonomic nervous system is an important part of heart rate oscillations. Breath training is a core component in heart rate variability biofeedback. Now, it's not the only way to affect heart rate variability. I've published an article based on Fred Schaefer's research and that of his research team. We published an article on the skeletal muscles and contracting the skeletal muscles rhythmically as a way to drive higher heart rate variability, and it works. But clinically, most practitioners are relying on breath training as the core component in increasing heart rate variability. So something about the relationship between breath and heart rate During each in-breath, our heart rate increases. Our blood pressure rises about 5 seconds later, so there's a lag before the blood pressure responds. Our baroreceptors, those are the sensors that regulate blood pressure, they detect this rise and fire more rapidly. Then, when we breathe out, when we exhale, heart rate decreases. Blood pressure falls 5 seconds after that. So there's a synchrony between respiration and cardiac activity. This is something that's present always. It's called the respiratory sinus arrhythmia, or people abbreviate that to the RSA. Now, it's always present, but in heart rate variability training, we enhance that relationship between breathing and heart rate. This is a schemata that was developed by Dick Gevirtz, and it shows the regulation of heart rate variability, kind of analogous to how we operate a car and the brake. When we breathe in, it disengages the vagal system brake and heart rate increases. The intrinsic cardiac pacers speed the heart rate. So when we take away the vagal system's braking action, heart rate increases. The drivers there is the parasympathetic system backing off. Then when we exhale, we're reapplying the brake, the vagal system braking action, slowing our heart rate. So we get an effect like this. Every time we breathe in, there's an increase in heart rate. As we exhale, a decrease. As we inhale, an increase, and so on. And when we time that at a rhythm in synchrony with our baroreceptor rhythms, that is the blood pressure rhythms, we get very large oscillations in heart rate. The resonance frequency is the breathing rate that produces the largest organized oscillations in our heart rate. Now, this resonance frequency, this is a label given this breathing rate, it was labeled by Paul Lehrer and the Bacillos, Evgeny and Branya Bacillo, in their laboratory at Rutgers. When we breathe at that rate, we are also producing breathing which is at the same time frequency as the baroreceptor rhythm, so the blood pressure rhythm. And what that means is what we're doing, we're putting two things together. The respiratory effects and the blood pressure rhythms come together in the same time frame, producing very large oscillations. On average, this is somewhere close to 6 breaths a minute, producing 6 cycles of heart rate increase and decrease in a minute. The resonance frequency varies somewhat by individual, but if you average it out, it comes to about 6 breaths per minute. When we assess resonance frequency, we guide the individual to breathe at rates from about 4.5 to about 7.5 breaths per minute, and we assess how much variability is occurring at each of those breathing rates, and then we choose the breathing rate, the resonance frequency for this person, which produces the largest oscillations. So once again, using a graph, if we're breathing at everyday rates, our breathing, this top blue line on the left, is much faster than the blood pressure rhythm, the baroreflex rhythm. So we're breathing much faster. There's still an effect of respiration on heart rate, but it's not so clear. When we slow our breathing down to our resonance frequency, then we have a synchrony in time frequency between our breathing and the blood pressure rhythm. And the result is shown over on the far right. We get very large oscillations in heart rate. This is called increased respiratory sinus arrhythmia, or increased RSA. Initially, as the field of heart rate variability developed, this was called RSA biofeedback, but now people largely call it heart rate variability biofeedback. So if we look here at breathing and the baroreflex, or breathing and heart rate, When we're breathing at everyday rates, when we're going about our life, having conversations, exercising, doing work, we have fairly rapid breathing and relatively small oscillations in heart rate. When we engage in heart rate variability training in biofeedback sessions, we produce those large blue swings in heart rate. And we're not expecting the human being then to go out of our office or away from their device and continue breathing at 6 breaths a minute or 4.5 breaths a minute. We're not expecting them to engage in resonance frequency breathing all day long. But doing this on a frequent basis, ideally about 20 minutes twice a day, begins to increase the baseline heart rate variability. And that correlates with lots of therapeutic benefit as well as increased performance in sports. So how does breathing affect the baroreflex, the blood pressure rhythm? If we breathe at resonance frequency somewhere around 6 breaths a minute, it increases these oscillations in heart rate, and this stimulates the blood pressure rhythm. Now, the most widely used training protocol for heart rate variability biofeedback is the resonance frequency protocol developed by Paul Lehrer, Yevgeny Vashilo, Branya Vashilo, and their team. We conduct a resonance frequency assessment. We guide the person to breathe for 2 to 3 minutes at rates between 4.5 and 7.5 breaths a minute. We determine which breathing rate produces the largest variability. We assess that variability using statistics like the heart rate maximum minus minimum. What is the swing between the high heart rate and the low heart rate? Another statistic, the root mean of successive differences. We look at low frequency power and the synchrony, peaking together of respiration and heart rate. But once we've determined the resonance frequency, the treatment is actually quite simple. Treatment shifts to the patient practicing smooth, paced breathing at the resonance frequency breath rate. The resonance frequency practice can be guided in the office with sophisticated biofeedback systems such as the Infinity or others, or we can ask the patient to guide the training at home with breath pacers or user-friendly consumer-grade heart rate variability instruments. Now, what's the effect? I mean, I've had people ask me, well, what difference does it make? Why do I care how my heart goes up and down? Well, there are some very clear pieces of scientific evidence showing a benefit for a number of disorders. Resonance frequency training has been shown to reduce symptoms in both medical and mental health disorders. Anytime we identify that a disorder is accompanied by autonomic dysregulation, then heart rate variability training will probably be therapeutic. Heart rate variability training using the resonance frequency model and other models is also widely used to enhance general wellness, resilience, and optimal performance. Now, here's a list of disorders for which we have at least promising evidence in research studies that heart rate variability can reduce suffering with these disorders. Some of the early studies done by Paul Lehrer and his team on asthma are highly rigorous empirical studies using a lot of medical measurements of effects on respiration, demonstrating that heart rate variability can actually reduce the severity of asthma, the frequency of asthma attacks, and the intensity of the attacks. Cancer pain, COPD or emphysema, as it's commonly called, chronic muscle pain, congestive heart failure, coronary artery disease, fibromyalgia, headache, hypertension, even pre-hypertension if we identify that somebody's blood pressure is in a preliminary stage indicating concern, we can already implement heart rate variability training. Irritable bowel, I've said pre-hypertension, preeclampsia in pregnancy, recurrent abdominal pain in children and adolescents, sleep disorders, anxiety, depression, PTSD, schizophrenia, substance abuse and cravings, and traumatic brain injury. These are some of the studies. You'll have this in your PowerPoint. These are some of the studies supporting the impact of heart rate variability on medical disorders. Mental health disorders, quite a few studies on anxiety, on depression, on PTSD, emerging studies on schizophrenia, and on substance abuse and cravings. Now, the best meta-analysis that we have so far is one conducted or published in 2020. The research team based at Rutgers, Paul Lehrer and his colleagues, they reviewed 1,868 published papers. They found that 58 studies were strong enough, rigorous enough in their research design to be included. They applied very stringent standards and picked those designs that showed the best research design and least risk of bias, and they drew these conclusions. Heart rate variability has the largest effect sizes for anxiety, depression, anger, and athletic and artistic performance. It has smaller but still significant effect sizes for PTSD, sleep, and quality of life. Heart rate variability training improves symptoms and functioning in many areas, both for people who are in the normal range and people who have serious disturbances. We still see benefits for both. It's a useful complementary treatment, adding additional efficacy when you combine it with standard treatments. Now, I've always been suspicious when someone begins to claim that their intervention is good for everything, and yet when you look at heart rate variability, the range of disorders for which it has shown benefit is quite wide. Why would this be? Well, what do we know about the mechanisms? The most widely cited mechanism is the role of the vagus nerve, vagal pathways, in activating the prefrontal cortex, the medial prefrontal cortex, which then in turn indirectly regulates subcortical centers for affect, for emotion. The vagus nerve delivers parasympathetic nervous system functioning in the cortical areas. And the pathways, especially what we call inhibitory limbic, are also a direct effect on centers or the limbic. And the third mechanism is strengthening of homeostasis in the baroreceptor system, the blood pressure. John Bale, can you still hear me?
Yes, we can still hear you. You were out for about 10 seconds. I think your internet connection was getting a bit weak. The web camera is now off, but we don't need the web camera. It's fine.
Oh, thank you. The baroreceptor are blood pressure sensors, and they have a direct impact on cardiovascular disorders. So strengthening homeostasis in that system is beneficial, especially for the heart and the cardiovascular system. Schroeder and his colleagues followed a population-based cohort of over 11,000 persons for 9 years. Among 7,099 persons without hypertension on baseline, low heart rate variability predicted much greater risk for the onset of hypertension. The authors concluded that decreases in autonomic nervous function precede the development of clinical hypertension. So they found serious impact on cardiovascular health in people who have low rate variability. There's a lot of medical studies that support these. and Thayer, in a chapter press, have proposed that vaguely mediated heart rate variability is an index. It serves as an index for how functional our prefrontal cortex. Now, the prefrontal cortex is the executive control center cortex. Conversely, they also propose that lower heart rate variability is a transdiagnostic marker of pathology. In other words, not just specific individual diagnoses, but it's a marker across diagnoses for psychological problems. Similarly, in another study, Julian Thayer and Beauchesne hypothesized that reduced heart rate variability shows general vulnerability, impaired functionality of the prefrontal cortex and its connections with subcortical brain regions. So we have a very strong neurophysiological hypothesis for what's going on here. So some promising new applications and special approaches. I'm going to begin by looking at some mobile devices and phone apps. Consumer-oriented heart rate variability training devices have been utilized for over a decade. The Stress Eraser was one of the first portable training devices developed by the Helicor Corporation and made available for home training and research studies. Dick Gewirtz was able to obtain Stress Erasers complimentary from Helicor, and a number of the dissertations done in his lab utilized the Stress Eraser. One example, Terry Zucker in 2009 utilized home training with the Stress Eraser in initial research on post-traumatic stress disorder and especially on depressive symptoms in post-traumatic stress disorder. She concluded that home training was adequate to produce significant benefit, significant reduction in depressive symptoms in people with PTSD. Her personal opinion was that she still would rather see the patients in office plus do the home training. But the availability of home training makes these interventions available on a much broader population basis because we don't have to utilize as much clinician time for each patient. Research protocols have either provided a combination of in-office training supplemented by home training, or increasingly provided in-office orientation and only home training. And I will present at least one study by Chung, which showed they utilized no in-office time. Everything was done through the device. Even the data gathering was through the device. So here are some top portable heart rate variability devices and apps. First, there are some devices that enable us to monitor heart rate variability. Now, these are passive devices. They record heart rate variability, but they do not provide feedback for training. One of them is the Viva. It's a chest heart rate variability or heart rate monitor used primarily to track heart rate during workouts, transmitting through Bluetooth and also through ANT. And I'll talk about those two media in just a moment. The Whoop, an advanced technology wrist monitor, transmitting data via Bluetooth. The BioStrap HRM, all-in-one heart rate monitoring, transmitting via Bluetooth and ANT. Now, polar sensors have been utilized for a couple of decades, but the gold standard current one is their Polar H10 HR sensor. It's a gold standard HR sensor using both Bluetooth and ANT. So we have an evolution. When I began biofeedback, we had hardwired devices. The trainee had to be in close proximity with the biofeedback instrument. We had to be concerned about potential electric shock. We utilized in the instrumentation something called optical isolation to insulate the patient from electrical current. And then fiber optic cables became available. This enabled the trainee to move around space a little bit, which was great when you were combining rehabilitation in pain disorders and neuromuscular disorders. The patient could move more flexibly. It certainly eliminated any risk of electrical shock. Then with the birth of Bluetooth, this allowed much greater freedom of movement because there was no physical connection between the patient and the biofeedback device or the computer. And then now we have advanced and adaptive network technology, or ANT, which enables the networking of sensor data with multiple devices at the same time. So you might have a computer connection. You might also at the same time have a smartphone, a tablet, and other devices all receiving the ANT signal. So now I'm going to move to portable devices that allow training. So they provide feedback to enable us to increase heart rate variability. Thought Technology has a system, the eView TPS system. It's a compact portable sensor providing physiological monitoring and training. It allows for 3 different physiological signals: heart rate, thermal, and GSR, or skin conductance, and it utilizes Bluetooth transmission. It's more expensive than some of these other devices, but it also provides the multiple modalities. So there's an advantage there, both in the office and for home training. The HeartMath M-Wave 2 is a standalone device providing visual feedback to guide increasing heart rate variability. It basically functions like a light bar. Well, it is a light bar showing increase and decrease in heart rate, and the patient is guided to breathe in as heart rate increases on the light bar and out as heart rate decreases. And this protocol typically increases heart rate variability. It transmits via Wi-Fi and USB. HeartMath also has the inner balance, which is an ear clip sensor which records heart rate, displays on your smartphone or tablet. It transmits via Bluetooth or a wire, your choice, although I prefer Bluetooth. And it has very sophisticated visual displays and breath pacers. So it's a very nice system for training. Leaf Therapeutics has a very original system. It utilizes adhesive patches to monitor heart rate. It has medical grade electrocardiogram recording. Most of the other portable devices use photoplethysmograph measuring changes in blood pulse volume, but this is actually an ECG, electrocardiogram, electrical recording. Feedback via your smartphone, but also feedback directly in the patch. A vibration guides the patient, and it's not a resonance frequency training. I'll come back to this in one of the research studies I hope to present. The vibrations actually guide you to breathe with your heart rate increases and decreases. There's also new software coming out from a company called Optimal HRV. Many of you know Ina Kazan, and she's a consultant to this company. This software enables resonance frequency assessment with simple consumer-oriented devices. It identifies the breath frequency that produces the largest oscillations in heart rate, the greatest SDNN, standard deviation of the time period between heartbeats, or RMSSD, another index, a statistical index. Finally, it also measures phase synchrony, how well respiration and heart rate are peaking together, increasing and decreasing together. This software works with a number of different devices. The HeartMath Bluetooth sensor, Polar Strap, Kyoto, CoreSense, and several other Bluetooth-enabled sensors. So breath pacers are simple, very simple devices, often free or inexpensive. Breath pacers guide the trainee to breathe at the resonance frequency. We can't use them to calculate the resonance frequency, but once we know the resonance frequency, we can send the person out into their everyday life using a breath pacer to breathe at that specific frequency. Awesome breathing, breath pacer, breathe to relax, breathing zone, my calm beat, breathe plus. are all breath pacers, which can guide breath training, meditation, and breathing practice. The inner balance and other devices often include breath pacers as well. So now I'm going to present some research studies.
If I may just jump in for just with one brief question. Someone asked from earlier in the presentation.
Yeah, go right ahead.
Yeah, someone was asking, when someone has high blood pressure, what does that say about the baroreceptor's rhythm in relation to one of those earlier slides? Oop, did we lose you, or did we lose me? Hold on. Oh, Dr. Moss is still there. Okay, we'll just wait for a moment for maybe his internet to come back, because I know it's a little bit unstable. Yes, there you go. The system says he did just lose his internet connection. All right, so we're just going to wait a second for him to be back with us. And it is just like this sometimes when you try to get a bunch of people from around the world all to tune together with the exact same internet connection. All right, so Dr. Moss, can you hear us now?
I can hear you. Can you hear me?
Yes, you've just come back. It's your computer lost internet connection for a moment.
Strange. Okay, thank you.
That's okay. So I was just going to go back to asking my question. Is that all right with you?
Yeah, go ahead.
Sure. So the first question is, when someone has high blood pressure, what does that say about the baroreceptor's rhythm?
I got out because I just got done discussing that. Blood pressure is multi-causal. So we have to look at a number of factors. One of them is the speed of the blood pressure of the baroreceptor rhythm. One of them is vasoconstriction in the artery itself, which is often caused by both diet and stress. Excessive sympathetic input will cause constriction in the artery. And then we have buildup in the artery of plaque, which is typically a factor of diet. Dean Ornish has done studies using lifestyle change, combining meditation, vegetarian diet, exercise, stress management, and actually reverse the narrowing in the arteries. So yes, the baroreceptor rhythms can be speeded up, and this can contribute, but we also have to look at the other causes for blood pressure. And heart rate variability is a useful intervention, but we should also pay attention to exercise and diet.
Perfect. I'm just going to ask you two more questions, and we'll let you keep going. What muscles and for how long is the duration of the muscle flexation that are used to increase HRV?
Oh, there's a research report in a recent issue of Applied Psychophysiology and Biofeedback. Fred Schaefer is the lead author on that, and I recommend you read that article. But basically, if you engage in upper body muscle tensing, tense the biceps and the hands, the wrists, in a rhythmic fashion at the resonance frequency for that person, you will produce heart rate variability changes. And you can increase heart rate variability on baseline with this kind of constriction or contraction, rather, of the musculature.
Perfect. And one more is, do you know the IOME2 device by Unite or Wild Define? Do you consider that a good device for HRV training?
I don't know the device, so I can't assess its effectiveness.
Okay. I'm going to keep the other questions till later, so I'll let you keep going. Thanks so much.
Thank you. Okay, so I'm going to present a study on recreational scuba divers that was done in our university by Brian Imber. This was a doctoral dissertation research project training recreational scuba divers. Well, first of all, we know that anxiety is a problem in scuba divers. There are a lot of scuba divers in the world. Just in the time period between 2010 and 2017, almost 400,000 additional individuals gained introductory level certification. Fortunately, serious accidents and deaths are not common, but about 19% of diving accidents are due to anxiety or panic, with anxiety triggering increased air consumption, emergency ascents, in other words, shooting up to the surface, sometimes causing decompression problems, and other hazards. I've been with divers who panicked and had used up their air supply at a time when we both had started at the same time. I still had more than half of my air left, and this other individual who was hyperventilating with anxiety had entirely used up his air supply. So anxiety is a relevant contributor to diving problems, which sometimes are fatal. IMBR recruited 9 certified recreational scuba divers with elevated state anxiety, used the state trait anxiety inventory to do baselines on them before and after. Each participant performed a pre-training open water dive, 5 one-hour training sessions, and then a post-training open water dive with physiological monitoring and questionnaires pre and post. I've mentioned the state trait anxiety inventory. He also used the profile of mood states, the general expectation for success scale, used the thought technology infinity electrocardiogram, respiratory sensor, blood volume pulse sensor pre and post, not in the water. In the water, he used a scuba dive computer, the Pro Galileo Sol Luna dive computer, which measures air consumption, airflow rate, dive time, heart rate, and skin temperature. He developed a training protocol combining heart rate variability training with a stress inoculation training that was based on a protocol from Donald Meichenbaum and Dennis Turk. So it's a cognitive behavioral desensitization for anxiety. This included psychoeducation, learning about anxiety, active practice of heart rate variability skills, and other coping skills. They assessed resonance frequency, they practiced briefly in office, and did home training with a breath pacer. The result was divers who completed the training showed significant reductions in how much air they consumed during the dive. They had lower heart rates during their post-training dive. High air consumption and high heart rate are markers for anxiety and potential problems in a dive, and these divers reduced both the air consumption and the heart rate. They completed the training showing a positive change in mood with less mood disturbance, less anxiety, increased vigor, comparing pre to post. They showed a positive increase in self-efficacy, that GESS, G-E-S-S score while diving, comparing pre to post-training. Brian concluded that this combination of a stress inoculation training and heart rate variability is a novel mind-body, provides a novel mind-body stress coping skill for scuba divers, incorporates slow rhythmic breathing at an optimal specific individual breathing rate, along with cognitive restructuring. This mitigated the symptoms of high anxiety induced by high stress during recreational scuba divers. So some nice benefits for a problem that we don't think about very often. Another much more widespread problem is test anxiety. And this is test anxiety using a portable biofeedback respiratory training device. Test anxiety happens when people know their skills are going to be evaluated or are being evaluated. Past studies have shown that 20 to 40% of college students experience test anxiety strong enough that it gets in the way with their performance. Something else which is important to remember is that test anxiety affects the student in advance of the test, during the test, and after the test. Before the test, they're preoccupied with the upcoming test, and they do not function as well in their coursework. During the test, their performance is impaired. They don't answer things which they might have been able to answer in a less anxious state. And then after the test, they continue to agonize about the test and about how they did. It significantly impacts, lowers quality of life. Rosenberg and Hamiel recruited 39 undergraduate students with high test anxiety, qualified 34 of them for the study. They utilized a self-help tool with minimal guidance by a clinician. The Calm Me Go device senses the current length of exhalation and guides the user to extend the length of the exhale using sound, light, and vibration feedback. This training reduces the rate of breathing. They assigned the participants to 3 groups: a biofeedback group who got the device and a handout with information about test anxiety. A second group received instructions to engage in self-directed breathing exercises, especially to slow their breathing, and got the handout. A third group got only the handout. All 3 groups completed pre and post measurements, including test anxiety inventory and the depression anxiety stress scale, along with the World Health Organization quality of life questionnaire. All 3 groups completed perceived change questionnaire afterwards, after the intervention. Participants in the biofeedback group achieved a significant decrease on the test anxiety measure. Participants in the self-directed breathing group and the handout-only group achieved only smaller and non-significant decreases on that test. The changes on the test anxiety scores were significantly different by statistics compared to the other groups. The Depression and Anxiety Questionnaire, DASS, participants in the biofeedback group achieved a significant decrease on the total score and the stress subscale score. Participants in the other groups did not. Quality of life. Participants in the biofeedback group improved on a well-being scale on this measure, not on the total score or physical quality of life, but on the well-being score. The other groups did not achieve significant decreases on this measure. I'm going to skip over some of the other results. The results showed that self-directed interventions to modify breathing produced positive effects in students with test anxiety. Now, there were some positive changes in both the self-directed breathing and the biofeedback groups, but the changes were strongest in the biofeedback groups. Participants in the biofeedback group also practice more frequently, and we often see this. We have better follow through with any homework in biofeedback groups, and people seem to utilize their skills more after treatment as well than when we simply engage in psychoeducation. The addition of the device appeared to provide added therapeutic benefit for self-help breath training. Okay, now here's a wearable heart rate variability biofeedback device for anxiety. So we know that anxiety is widespread. 19% of US adults have had an anxiety disorder. Many times people with anxiety also suffer with depression and other emotional complaints. Patients with anxiety and depression suffer more chronic and recurrent forms of medical illness as well. Only 36.9% of persons with anxiety in the US receive any kind of treatment. Globally, anxiety disorders are a leading mental health related cause of disability, especially in young people and people in the mid-range, age 40 to 44. Highest impact of anxiety causing disability and loss of everyday function. Women are more severely affected and more severely disabled than men from anxiety. So Andre Chung and colleagues recruited 14 adults with clinical anxiety. They utilized measurements that were administered within the Leaf mobile app. So the smartphone or tablet administered the generalized anxiety disorder questionnaire and the patient health questionnaire. These are measures of anxiety and depression. They included people who had indications on the GAD-2 of clinically significant anxiety, They excluded people who had more severe depression. They excluded a number of other individuals, patients with heart disease, those on anxiety medication, or who were seeking additional treatment beyond the research study for anxiety or depression. The device they used, I mentioned earlier, it's called the LIEF, L-I-E-F. It's a smart patch. It uses the electrocardiogram, the electrical signals from the heart, to collect heart rate variability, and also accelerometer data, movement data. One of the advantages of this system is people wear it for several hours through the day. It delivers heart rate variability feedback in the moment in the course of everyday life. It has a discrete form factor. In other words, it's not visible to those around you. It's under the clothing, delivers heart rate variability feedback by vibration. It's also a very accurate signal because it's based on the electrocardiogram. I mentioned earlier, it does not use a resonance frequency protocol. Rather, it directs the trainee to breathe when the heart rate, to exhale when heart rate drops, and to inhale when heart rate increases. The result is a magnification or an amplification of RSA amplitude. So the oscillations in heart rate get bigger. Interestingly, this is the same training protocol that the Russians who first developed heart rate variability biofeedback in St. Petersburg, Russia, were utilizing. They had a device called the cardio signalizer. I actually had one for a number of years. And it was basically a light bar. You inhale as the heart rate increases, you exhale as the heart rate drops. And by adding breathing at the same frequency as heart rate changes, the heart rate changes themselves get larger and larger. The LIEF system uses multiple 3-minute training sessions. The trainee feels the vibration guiding their breathing and sees, and if they want to, they can also look on their smartphone and see a line graph of the changes in heart rate. The LIEF uses the actual RSA line graph for real-time feedback and presents the person with post-session comparisons using some statistical indices, telling them how well they did. These subjects also got 10-minute telephone coaching sessions. They were introduced to heart rate variability, instructed in the device. They learned how to identify triggers for stress and anxiety, how to apply heart rate variability for their overall wellness, how to cope with challenges in these coaching sessions. They also learned to analyze their own stress response and also some approaches for managing difficult emotions. Now, interestingly, as I mentioned, there was no face-to-face contact between the researcher and these individuals. I'm watching the clock and realizing I'm not going to get through my second section here.
It's okay.
However,
I was going to let you know once you're done with this particular case.
Yeah, thank you. So what happened? The mean generalized anxiety scores dropped 3 points. Only 14% of the participants would score as clinically anxious at the end of the study. Depression scores dropped significantly as well. Basal heart rate variability increased significantly in these patients across the course of the study. So this is a graph showing their generalized anxiety score. So this study had some weaknesses. It had no comparison of baseline heart rate variability to a baseline post-treatment, which would have strengthened the study. However, the study implements a user-friendly wearable technology for self-directed training assisted by telephone coaching. This study offers promise for inexpensive interventions with only minimal expenditure of professional time. The participants showed clinically significant reductions in both anxiety and depression. 86% of the participants moved from a level that we would diagnose them as having a disorder to a level where we would not. They were normal range. So during the pandemic, especially, this was a wonderful boost, providing training with no face-to-face contact. Now, I'm not going to be able to present some of my other case studies, but if you look at the PowerPoint, you can see a very interesting study on female sexual arousal disorder with heart rate variability making a significant difference. Again, breath training and respiratory biofeedback, second half of my presentation. Maybe I'll come back at another time and present on respiration as the primary focus. But what's interesting is that there is very good data showing that we can train respiration as well using a capnometer as well as using what's called a respirometer. And we can help people with panic disorder. We can help people with generalized anxiety disorder. And as a study by Ostaker showed, we can help people with PTSD and make significant differences in their PTSD. The conclusions from that study, the Ostaker study, were that capnometric training provides therapeutic benefit in application to patients with post-traumatic stress disorder. It produced physiological as well as behavioral changes. And if we identify people who have low carbon dioxide when they begin treatment, those were the people who got the greatest benefit and showed the greatest physiological changes. So we've got physiological markers even for when we should use a particular biofeedback treatment. The authors of that study concluded that success in achieving physiological changes strongly improves perceived self-efficacy. So when I've been able to make changes in my physiology and it reduces my emotional symptoms, reduces my distress, I gain confidence in myself that I can have an impact on my life. And as many biofeedback practitioners have observed over the years, this increase in self-confidence generalizes to the rest of my life. We see people taking on challenges at work. We see people making changes in their relationships. And it often starts with regaining confidence in themselves at a very basic level because they've now been able to increase their heart rate variability and reduce their anxiety symptoms. So that kind of summarizes what I see in this whole body of literature, the importance of it, and I'm open to questions that have been submitted. John?
Thank you very much, Dr. Moss, for the presentation. It's okay. There's a lot of good content, and as you said, in the attached PDFs, which all attendees can see in the handouts, if you go to the GoToWebinar control panel, you can download that PDF and see the rest of his presentation. So it's all very much available there. We do have 2 questions right now, and I realize, do you have several minutes or do you have to get going?
I do. No, I'm fine.
Perfect. So first question I'd like to throw at you is, do propanol-like drugs work against HRV training?
They can. If the person is on high dose, you may see very little change.
Okay.
I have treated people who were on propanol or a similar medication and still found benefit, but you're not going to see as large an increase in heart rate variability in the training.
Okay, perfect. Another question is kind of a 2-parter. This individual is looking for clarification on how important diaphragmatic or abdominal breathing is for HRV training. Is it essential to be doing diaphragmatic breathing before HRV training? How can you help trigger that diaphragmatic breathing?
Okay, well, first of all, I think we can accomplish heart rate variability training with breathing that is not primarily diaphragmatic, but I personally, there's enough evidence that diaphragmatic breathing is helpful, it's therapeutic in itself. So I usually begin the training process by training breathing. And I use a breath pacer. I use the, because I have the Infinity, I use the respirometer on the Infinity system to display a line graph showing the breathing. So the person can see each individual breath. They can see evenness of the breathing or raggediness of the breathing. They can see where they've breath held or where they've increased the frequency of their breathing. So they're learning what the process of their breathing is. And I use the abdominal placement because I primarily want to emphasize an enhancement of that abdominal breathing. As Eric Pepper has pointed out, occasionally people are so stuck in a thoracic chest breathing pattern that we actually have to help them by using both the abdominal and a chest placement for breath bands. And we also can utilize muscle biofeedback to measure, for example, the trapezius muscles are often tight and inhibit breathing overall. So as we relax the musculature and we reduce especially muscle activity that accompanies the breathing, we do not have to tighten up the thoracic or the trapezius or thoracic muscles to engage in a healthy abdominal breathing. So we relax the musculature. We ask the person to monitor their own breathing with a hand on their abdomen, or we have them lie on the floor and place a heavy book on their abdomen and watch that book rise and fall, feel that book rise and fall as they engage in diaphragmatic breathing, breathing low, breathing from the diaphragm, breathing evenly, breathing slow, breathing smooth. So LESS, less, low, even, smooth, and slow. That's the acronym I use with people to guide them. And I usually do that before I do the resonance frequency assessment, because we also have to teach the person to be aware of their breathing enough that they can breathe at different rates. Otherwise, the resonance frequency assessment is not possible. I can put the biofeedback screen, I can set this breath pacer on the screen to 4.5, 5, 5.5, 6 breaths per minute. But if the person continues to breathe at 16 the entire time, then we're not going to learn what their resonance frequency is. So I hope that answers the question.
That's actually much longer than I thought the answer would be. That's excellent. A quick follow-up.
Well, I believe a lot in breathing. So.
Oh, it's good. People want these details.
Yes.
A follow-up is, would you apply the same thought process or procedure with children as opposed to just adults?
I do. Of course, Linda Thompson, not the Linda Thompson of Toronto, but the Linda Thompson of Vermont, who primarily does hypnosis, also teaches children to do belly breathing or abdominal breathing. And she uses a bright yellow rubber ducky placed on their tummy and asks them to help the rubber ducky to ride the waves of their belly breathing. So yes, I do follow the same protocol with children, but much shorter feedback training sessions, interspersed with play, interspersed with artwork, all of the kinds of things that one does in child therapy. But I've had children do very well with heart rate variability. I use in the office, I use the Infinity, and I've created a number of animations, but I also use the HeartMath system because that one has a number of animations already. So we simply have to give developmentally appropriate feedback and instruction to children, but they certainly can benefit from heart rate variability and breath training.
Thank you very much, Dr. Moss, for that answer. And I think we're going to call it quits at this point because we are quite over time. So I'd like to thank all the participants who did show up to us for this live event, and you will be getting copies of both the PowerPoint in case you didn't already download it, as well as this recording in case you want to look back to it. And thank you very much again, Dr. Moss, for being able to present and being patient with the little kind of hiccups that we've all been experiencing. And so with that, we are going to end it for today. So all of you have a wonderful day, and you'll be getting this material from us very soon. Okay? Perfect. All right. Thank you again, Dr. Moss.